With the advancement of technologies in the past decade, people can more easily track their physical and cardiovascular health than ever before. We believe that there are numerous reasons why users should not rely on these wearables to make decisions about their health. Some of these reasons include lack of federal regulation within wearables, unintended behavior modifications that users might make, security risks for the devices themselves that impact the users, and a general lack of scientific research into how wearables affect health in the long run. Currently, the FDA does not regulate any health or fitness sensor that is designed to, quote, promote general wellness within the user. This lack of regulation allows any product, such as a wearable with a heart rate monitor, to be sold in the United States without any validation of accuracy or precision of the sensor itself. Users of wearables will often rely on these sensor readings to make decisions about their health. And when users make decisions on their own without discussing these decisions with their doctors, they might end up making the wrong choice for their health. Also, users might make unintended modifications to their behaviors as a result. Some of the best ways to have a healthy heart is to get adequate exercise and eat properly. And when wearables are used to monitor current health and fitness, users can glean insights on how to improve their behaviors to make their heart and body healthier. However, when a wearable is used to track fitness and cardiovascular responses, the user may make changes to their behavior for the worse because they may perceive their current activity levels as more than they need. This may include reducing exercise amount because they might perceive their exercise quantity as more than they need in their daily schedule. In general, when exercise is decreased, the risk factors for cardiovascular disease increases, and these unintended negative effects on current activity levels may also increase risks for diseases such as heart disease. Also, wearables pose some slight security risks for the users themselves. Due to the connected nature of the wearables, they are susceptible to certain security vulnerabilities. There are two main forms of security vulnerabilities. The first is the privacy and censored data exposure. When a user's private data and personal information is vulnerable, an attacker might try to steal their information to be used against them in the future. The second risk posed for security is the adversarial and attack risks. These risks and attacks are extremely harmful to the user because they can be used to change and alter user data, which might allow the user to change their own routines in the negative. When a sensor data is manipulated, the user might rely on that data to make changes to their lifestyle that could be harmful to their overall health.
The American Heart Association assesses the wearable technology's ability to monitor Life Simple 7, which are listed here. Wearables really only have the ability to directly track physical activity. All of the other metrics, while they can be monitored, typically rely on either the user's submission for, as far as healthy eating goes, that requires the user to appropriately track their eating, which is not a given. The user could be more or less accurate with that. Additionally, as far as cholesterol management and blood sugar management, these have to be tracked over a very long period of time in order to actually make a difference for the user's cardiovascular health. This paper, written by professionals in the Division of Cardiology at Emory University School of Medicine, provides a chart of some studies that have been shown to supposedly support wearable technology. Taking a closer look at these studies though, you can see that a lot of the sample sizes are relatively small and will not be applicable to humans in general. Additionally, the findings are quite vague, saying lower BMI, how much is it being lowered by? Increased physical activity, how much is that really being increased by? Those are vague findings and not quantifiable, so it's hard to really know that these are positive results. Additionally, They only have an impact if they're continued over a long period of time. Again, blood sugar and cholesterol will only be impacted if it's a very extensive period of time. Someone who is an overweight adult, 6 months is probably not going to completely alter their lifestyle unless they continue that for a longer period of time, which these studies do not talk about at all. In conclusion, for the reasons that we discussed, wearable technologies are not a significant source of maintaining cardiovascular health, and especially since cardiovascular disease is the largest cause of death, there needs to be a better resource for patients and cardiologists to rely on. And wearable technology is not going to guarantee that satisfaction.